So before we head outside, I think most of us are already there. This weather's been incredible. Of course, we know to lather on the sunscreen. A new study just revealed that sunscreen can greatly reduce our risk of developing skin cancer. And we spoke with a doctor yesterday about the importance of sunscreen and the amount that we're all using. But today we want to focus on treatments for skin cancer with Dr. Vadiма Gущina. He's the director of gastrointestinal oncology at Mercy Medical Center. So I wanted to ask you specifically about treatments and what to look out for those of us like myself who need to avoid the sun specifically. What are the warning signs, other than, you know, some bad sunburns early in life? What are the biggest warning signs that we should be watching for?
Well, you'll be surprised, but non-professionals are very good at picking out suspicious skin lesions.
That's good to know.
Yeah, they look unusual. The family members may look at you and, you know, this black dot or dark dot looks a little bit different. It's maybe bigger, the edges may be uneven, and the coloring is a little bit uneven.
It's off, okay.
Yes. So that's the good prompts to go to a dermatologist or your primary care physician to check it out and maybe to do a biopsy. Do
you recommend that everyone have that, that full body screen by a dermatologist at some point so that you kind of have a, what's the word, baseline for what, you know, a particular mole looked like 2 years ago? Is that good for everybody, or are there just certain people who should do that?
Well, scientifically speaking, it is not known.
Okay.
However, definitely people like you, for example, fair skin, blonde, blue eyes,
prone to sunburn,
sunburns when they were younger, definitely should be checked out by a dermatologist. It's a very good idea.
Okay. So once you, for instance, have seen a dermatologist, you found out that you have, you know, my parents, I use them as an example all the time, are constantly getting things, they call it burned off of their skin.
Right.
Tell me about that process, that treatment process.
Well, most likely you were talking about non-melanoma skin cancers like basal cell carcinomas, squamous cell carcinomas. So dermatologists are rather good at picking out those particular troubled lesions. They sometimes don't even need a biopsy. So that's where the burnout lesions come from. However, melanoma, which is a more serious and deadly cancer, this cancer needs to be biopsied first to figure out the treatment plan.
Okay. And what does that look like these days? Are there, you know, advances being made? Is it really still just catching it early that's the key?
Well, actually, it's been a lot of buzz about melanoma treatments recently. We have immunotherapy, we have smart drugs or targeted drugs coming out, and very, very advanced immunotherapy treatments are coming out. So it's a lot of hype in the oncology community about this.
Okay.
However, I still think that it's a good idea to avoid the direct sunlight.
Sure.
And that's the key to prevention. You really don't want to go to this advanced treatments.
You don't want to be, exactly, you don't want to be in a position to need it. Dr. Gущina, thank you so much for being here this morning. Really appreciate it. Of course, it's important to talk about it, particularly as we head into these warmer months. Thanks for being here this morning.
Quite welcome.